Hello everybody, in this video we will speak about the case of John, 49 years old man. And at the first sight he had a frowed face, looked down, and he was sighing, like depressed or irritated, angry. I couldn't express it at this moment. How can I help you? Open question. I have a problem with my right elbow. It started to be painful and orthopedist gave me orthosis, and then for some time it was quite good, but then I changed work and it appeared again. In a new work it returned. It's a simple reflection. I began to use orthosis again, but this time it did not help. It seemed even worse. So at this moment it sounds like maybe tension, something that repeats, gores. He seems quite maybe even hopeless at this moment. But it's my fantasy. And he may also have a fantasy that this job damaged his elbow, so it would sound like willow. You are disappointed that orthosis had not helped. It's a reflection that reveals underlying emotions, especially tension, disappointment. And when I wake in the night, it is painful and there is a stitching and I cannot fall asleep again. I must be careful when I make some movement. Carrying a cup with coffee is sometimes enough, and the stitch is there. Maybe mimulus, maybe fear that when he does some wrong move it starts to be painful. And also it's quite typical for physical complaints that we often use white chestnut, because these people often think quite a lot about these physical problems, and it makes them still worse. You must be careful when you do something, otherwise it provokes pain. Simple reflection, but it also directs a little bit to mimulus. I am angry because of that. I'm a right-hander, and a man and a right-hander that cannot do anything, and it makes me nervous. I feel like a cripple. I need to do many things. Even go shopping has become a problem to me. So it's limiting, and people who do not like some restriction by physical problems are usually need oak. Depressed because of being limited by physical complaints, impatience because of his restlessness and hurriedness, and vervein. It is bad when I cannot carry anything in right hand. In fact, I can carry it, but then a stitch comes and I cannot do anything for 2 hours. Maybe there is some psychic block. Maybe I have a fear that it will be painful. So it sounds like mimulus. Apart from that, there may be also tension and willow also. You have a fear that it begins to be painful, and if you aren't cautious enough. Reflection exploring mimulus theme. Yes, it is something terrible for me. I am not 50 yet, and I'm absolutely useless. I cannot move with my hand. Whatever I do, it gets worse. And it lasts so long, and it does not get better. I hope that with a change of job it would get better, but it is the same. So again, the restriction by physical complaint. Oak, something that it's quite pessimistic, this view, that nothing helps, so it's maybe tension or even gores for hopelessness. It's too long and there is no improvement. Reflection exploring gores theme. But it is my bad luck. I had varicose veins on my legs, there was a pain and feeling of heaviness, so I went to an operation. I was told the operation had been successful, but it is still painful. It is painful, it burns, it is annoying, and there is no change. Again, something, it repeats again the same pattern. At first it seems positive, but then a problem comes and it gets worse. So again, tension, and maybe also some sort of embitterment against fate, that he must deal with some problems over and over. You hope that the operation would help you and a pain remains there. This is two-sided reflection. You hoped and the problem remains. Corresponding to tension again. That is why I have fear whenever I am to go to some medical procedure. I always expect that it will get worse, that there will be some side effects. So there is a theme of fear, mimulus, and also a pessimistic attitude, that even that nothing is wrong in this moment, he expects something wrong. You expect problems even when there aren't any yet. Exploring tension. Yes, but it is in my life generally. In previous job, they used a trick against me. They had promised me something, but then they did not fulfill it, and I had to make a choice, either to accept some financial loss or to leave. So I left, and another person got my previous work with much better conditions. So it was unjust. So Willow, it's quite typical for Willow, but another remedy for a feeling of injustice is vervain. So we also should take it into consideration. It was unjust to exploring Willow theme. Then I started another work, but the company went bankrupt. And then I worked as a security guard in a supermarket, but the work was too stressful, so I had to leave. And then I worked in a storehouse, but this work was physically demanding and the problem with the elbow started. So again, repeating pattern, starts well, then a problem appears and he has to stop the work. And again, maybe the theme of Willow, of ill fate, and something repeats over and over. Maybe he makes some mistake when he, for example, looks for a job, so maybe chestnut butt. Your fate was really unkind to you. Again, exploring Willow. Yes, and this pain, it makes me more and more irritable. My wife tells me that I burst because of trifles, but it makes me really nervous. So there is an inner tension that may correspond to impatience. So, which remedies do we consider? Gentian, gorse, willow, gentian for repeated failures and starts well, then goes wrong. Gorse for hopelessness, it lasts too long. Willow for feeling of ill fate. Oak for despondency because of being limited by physical complaints. Mimulus, a fear that his physical complaints get worse after some exercise or work. Impatience, inner tension and nervousness, he bursts easily. And then also other remedies that do not correspond perfectly, but we can also take them into consideration. White chestnut, thoughts that circle in the mind and he cannot sleep because of them, maybe. Vervain. And then he admitted that he worked as a cop and he has some rules, principles inside, and he sticks to them. So, and that is why he felt this injustice. So maybe vervain and chestnut butt for something that repeats over and over. So the limit of 7 essences, and this is our agreement. This is our conclusion common. So gentian, gorse, willow, oak, mimulus, impatiens, and vervain. That's the change. He added vervain. And 6 weeks later, sometimes the elbow seems that it is a little bit better, but then it gets back again, and the leg is annoying. And at work there are problems, and I will probably have to change it again. It's typical for gentian or gorse that they do not admit easily that there is some improvement, so they remain pessimistic during the therapy. 3 months later, the elbow is better, but the leg is the same, no improvement. And at work there are problems, but I have already started to look for another job. So he has become to be more active. 6 months later, the elbow is almost okay, and maybe even the leg is also a little bit better. And I have started a new job, and it seems quite good. And 1 year later, the elbow is fine, and the leg is also quite good. And the job is also good, so I hope it will continue this way. He seems optimistic in this moment. So, what techniques we have used in this case? Simple reflections, just repeating what the patient has told. Two-sided reflections, reflections revealing underlying emotions, like you were disappointed that orthosis had not helped. And we also used reflections to test corresponding remedies, like it was unjust to you, you must be careful for mimulus, it is too long and there is no improvement for gorse. And we also used open questions. And open questions are questions that cannot be answered by simple yes, no, or one word or one short sentence. So these questions are very useful because they help to explore the theme more in detail, and they invite the patient to speak spontaneously. And so how to ask to create open questions? So you can ask how or what, or tell me more about, or what about something. And do not ask why, because when you ask why, it may evoke in the patient the feeling that you think that it is his mistake, that he is ill, or that he has the problem. So do not ask why, but you can ask how or what, or tell me more. So if you like to learn more about the techniques I use during case taking, please click on the link to the video below. I hope you have enjoyed it. And in the next video we will continue with case 3 of a 60 years old woman, Vera.